Assalamualaikum. My name is BALQIS binti AZMI. I will present about introduction of National COVID-19 Immunization Program and also factor implementation of National COVID-19 Immunization Program. So now we move to introduction. The COVID-19 pandemic in Malaysia has been part of 2019 global coronavirus disease pandemic that hit the world. It is caused by coronavirus 2, SARS-CoV-2, with over 2,004,000 confirmed COVID-19 cases, over 60,000 active cases, and over 29,200 deaths as November 5, 2021. Malaysia now ranked in third in Southeast Asia in terms of COVID-19 cases and deaths after Indonesia and Philippines. On January 25, 2020, the first case in Malaysia was confirmed among Chinese visitors in Johor from Singapore, and it was limited to a few import cases until March 2020, with many local clusters occur. Following the Sabah state election in September 2020 and many outbreaks at top glove factories in late 2020, Malaysia had its third wave of COVID-19 infection. To combat the pandemic, the Malaysian government reinstated MCO limits in most states since November 2020. Following a COVID-19 outbreak in Malaysia, the government has begun a countrywide COVID-19 immunization program to curb the virus spread. The countrywide COVID-19 immunization program, PIC, in Malaysia is a national vaccination initiative launched by the Malaysian government to combat the spread of coronavirus disease and put an end to the pandemic of this respiratory disease in Malaysia. Prior to the implementation of the National COVID-19 Immunization Program, Malaysia had already launched an immunization program to prevent diseases such as measles, mumps, rubella, tetanus, HPV, diphtheria, and thalassemia. The Malaysian government has provided free injection to the people in the school level to maintain the optimal health status of school children through regular health regulation and screening, as well as for prevention of infectious diseases through immunization. Now, we move to the factor of implementation. The first factor of implementation of this program is to ensure as much as possible the population in Malaysia receive the vaccine to save the life of all within a short period. Vaccines are one of the most effective approaches for Malaysia to control the outbreak and protect people against COVID-19. All Malaysia and non-Malaysian citizens will receive the vaccine free of charge in an effort by the Malaysian government to ensure the spread of this pandemic among the people can be reduced. Moreover, vaccines have been shown to save millions of lives and prevent millions from suffering and misery. The COVID-19 vaccination is available in a variety types, such as AstraZeneca, Pfizer, BioNTech, Sinopharm, and two types of Chinese vaccine, which is Sinovac and Casino. It is the Malaysian government responsibility to guarantee that the vaccination is well received in Malaysia, has fewer adverse effects, is effective against COVID-19, and also cost-efficient to the benefits of people. Next, the second factor of this program implementation is for the Malaysian government economic sector to be restored in order to assist the restoration of people's life. Following the spread of pandemics around the world over the previous years, the success of this vaccine effort is inextricably linked to recovery of the affected economy. When this vaccine campaign is successfully conducted, domestic consumer confidence will improve, resulting in increased private consumption, which is one of the most important components of GDP development. As a result, when the vaccine is distributed through this program, consumer sentiment, which is a sense of security, can be improved. Positive growth in household spending accompanied the easing of mobility restriction when vaccines were received, and additional economic sector were opened up, resulting in an increase in private consumption.
Assalamualaikum, I am Binti AZIZUL and I will explain about the phases of implementation COVID-19 immunization program. The implementation of the National COVID-19 Immunization Program is given to all Malaysians aged 18 years old and above, including non-citizens living in Malaysia. Malaysia has established a vaccine policy where the COVID-19 vaccine will be provided free of charge. This is the government's approach to ensure that at least 80% of Malaysians have been vaccinated by February 2022 to reduce the spread of COVID-19. The implementation of COVID-19 vaccine began in Phase 1, which was conducted in February to April 2021. There are two group divisions in Phase 1, which is Group 1 for frontliner workers, which includes government and private health workers, while for Group 2 for frontline personnel, which include essential and defense services. This is to ensure that these health workers are protected from COVID-19 infection so that the national health sector can continue to operate at optimum level. This phase targets 500,000 frontliners workers to be vaccinated. The implementation of COVID-19 vaccination shifted to Phase 2. This phase started in April until August 2021. In Phase 2, there are three groups at risk for complication in the event of COVID-19 infection. They should therefore be given the COVID-19 vaccine immediately to prevent them from being infected with COVID-19, which will have a worse effect on themselves. There are three target groups involved in Phase 2, which are senior citizens aged 60 years old and above, individuals with chronic disease such as heart disease, obesity, diabetes, high blood pressure, and other chronic disease, and the disabled OKU. This group is given priority to reduce mortality and morbidity as well as to reduce the burden on the Malaysian health system. In this phase, an estimated 9.4 million people will receive the COVID-19 vaccine. The National COVID-19 Immunisation Program continued with Phase 3 begin in May until February 2022. Phase 3 was to control the spread of the epidemic and break the COVID-19 chain. Vaccination in this phase is focused on high-risk cluster area through risk assessment to control disease transmission. The implementation of COVID-19 vaccine is extended to all Malaysians aged 18 years old and above to ensure that 70% up until 80% of the population in Malaysia receive the vaccine, thus being able to achieve cluster immunity. In this phase, the vaccination center (PPV) is expanded to involve public facility, private facility, and other facilities provided by the government. In mid-September 2021, the government has conducted the National Adolescents COVID-19 Immunisation Program (PAID). The National Immunization Program is extended to certain adolescents, such as adolescents aged 12 to 15 years old with certain health problems, and all individual adolescents aged 16 to 17 years old with or without certain health problems. This measure is in preparation for the opening for schools to ensure that the risk of infection in school can be reduced, thus preventing this occurrence of clusters and cases among school children. This involves all categories of adolescents, including those who were not in school. For the smooth running of this vaccination program, MySejahtera application and the special website have been adopted and can be manually if the community does not have access to the MySejahtera application. The implementation of COVID-19 vaccine is voluntary but is highly recommended to enable the target of cluster immunity formation to be achieved. For the vaccine registration and appointment process, the government has provided 5 methods of registration online or manually for the public to obtain COVID-19 vaccine injection in the country. Registration for the public is now open through the online method is registration through MySejahtera application or a special website at www.vaccinecovid.gov.my. As for manual registration, there are 3 methods that allow the public to register, which are by contacting the hotline, attending public and private health clinic facility, or through existing program for residents in rural and remote areas. By any appointment information such as the date and place of vaccination will be notified through the MySejahtera application, phone call or short message service (SMS). The vaccination process for those who register online or manually is the same, which is covering the 18 steps.
Assalamualaikum warahmatullahi wabarakatuh. My name is NURUL binti JAMALUDDIN, and I will proceed to the challenge of implementation this program. The first one is vaccine queue jumping. So there are allegations from Malaysian community that there are certain group try to receive or try to get the vaccine early ahead from other group, such as the VVIP group or so on. So the case is where 200 Kelantan state secretaries try to cut the lines to be the early recipient for the COVID-19 injection. So there are new provisions under the Emergency Prevention and Control of Disease, where if an individual cut the line to get COVID-19 vaccine injection, so they can be fined not more than 50,000 ringgit or imprisoned for maximum 60 months or both. So the government also try to control this issue by establish the guideline for the frontline task force to avoid the influence of anti-vaccine in Malaysian society. So the anti-vaccine group in Malaysia continue to oppose the PIP program by selling products that are supposedly capable for being alternative to vaccine. So they try to confuse people about the vaccine by selling the product replace the COVID-19 vaccines such as ivermectin, vitamin C and various type of oil. So the anti-vaccine propaganda and misleading informations can be punished under section 505 and sections 233, which is imprisonment up to 2 years or fines or both. So the government has facilitated by allowing only recipient for 2 doses for cross-district and state, dine-in at the food premise, allow prayer in the mosque for Muslim and others. Last challenge is the issue of empathy vaccine. So the case of health worker were reported to have mistaken an empty syringe that had been used from the same table with the syringe containing vaccine and injected the empty syringe on the 12-year-old boy. So Dr. Nur Azmi described the incident as an error while on duty or human error and asked health worker to be more careful and follow the prescribed procedure. So the health worker also dismissed from her duty at the vaccination center PPV of University of Malaya. So and then the teenager parents give the permissions to the teenager to get vaccine injections according to the last dose procedure. So what is last dose procedure? Last dose procedure is a guideline that recommended administrations for the vaccine in the opposite arm if the first dose is deemed insufficient or redose is required. And then the government also establish the SOP where each vaccination worker must show the syringe containing the vaccine to the vaccine recipient before the injection is performed. Wide reaction people towards this program. So in the positive side, so the entire community towards the national vaccination program was positive, with the vast majority of Malaysians registered to be vaccinated. So around 95.3% of the adult population in Malaysia have been fully vaccinated. And the majority of Malaysians believe that vaccination for infection disease should be mandatory for everyone. So according to IPSOS Malaysia, the market research company, around 86% of Malaysians involved in the survey strongly agree that vaccination against serious infection disease should be mandatory. There are also negative reactions toward this program. The ongoing dispute by irresponsible parties over the COVID-19 vaccine program by the government also raised the vaccine hesitancy and extreme public skepticism towards the vaccine. So the public also concerned about the side effect of the COVID-19 vaccine, such as fever, tiredness, headache, and so on. So the side effect from the vaccine injections indicate the body immune system to responding.
Assalamualaikum, my name is NURUL ELESYAFIFAH binti RAHMAN and I will continue with the comparison of COVID-19 immunization program in Malaysia and Indonesia. The first difference is the type of vaccines, which is in Malaysia has secured 66.7 million doses of COVID-19 vaccines through the COVAX facility and advanced purchases from 5 vaccines manufacturers for February 2021. Supply of COVID-19 vaccines that have been acquired by Malaysia are namely Pfizer, AstraZeneca, Sinovac, CanSino Bio and Sputnik V. All of these vaccines can be imported and used in Malaysia after being evaluated by the National Pharmaceutical Regulatory Division (NPRA) and approved for registration by the Drug Control Authority (PKBD). Meanwhile, for the Indonesia, at least 10 vaccines have been granted an emergency use permit by Food and Drug Supervisory Agency (BPOM) of Indonesia, and some of them have been used for mass vaccination. The 10 types of COVID-19 vaccines that have been arrived in Indonesia until August 2021, namely Sinovac, Novavax, AstraZeneca, Moderna, Pfizer, Sinopharm, Janssen, CanSino, Novavax, and Zivivax. The other differences of COVID-19 immunization program in Malaysia and Indonesia are the phases of the vaccination programs. The Malaysian vaccination program is divided into 3 phases. The vaccines will be distributed throughout the country in stages based on vaccine manufacturer supplies and deliveries. The first phase of the program focuses on 2 priority groups, which the first priority group consists of frontliner healthcare workers from both the public and private sectors. Meanwhile, the frontliners, who include essential services, defense, and security personnel, are the second priority group. This phase timeline runs from February to April 2021. For the phase 2, it also focuses in 2 priority groups, which the first priority group focused on remainder of healthcare workers as well as those in essential services and defense and security personnel. The other priority group, that second phase focus, are the senior citizens, which those aged 60 and over, the high-risk group with chronic disease, and people with disabilities, OKU. The phase started from April until August in 2021. For the phases of the vaccinations program in Indonesia is divided into 2 phases for more 40.2 million people of the population. The first phase, which is scheduled to last from January to April 2021, targeted approximately 1.3 million healthcare workers, assistant support staff, and medical students working in facilities between the age of 18 and 59 in the first phase. Furthermore, the first phase targets public employees and elderly citizens. Meanwhile, the second phase is aimed at 17.4 million members of the general public and public officers, which include teachers, villagers, and sub-district officials, states, civil servants, police, military, legal enforcement officers, and other public officers. The second phase will take place between April 2021 and March 2022. The last differences are the vaccinations program. In Malaysia, there are 2 vaccinations program, which National COVID-19 Immunization Program and National Adolescent Immunization Program COVID-19, Peak Teenagers. For the National COVID-19 Immunization Program, the Malaysian government has taken an integrated and structured approach to the country's vaccine acquisition effort. As the primary committee in the planning, implementation and monitoring of the entire national COVID-19 immunization program, the Special Committee for Ensuring Access to COVID-19 Vaccine Supply (JKJAV) plays an important role. Participation in this facility ensures that vaccines are available to 100% of Malaysians. The COVID-19 vaccination is voluntary and will be provided free of charge to all Malaysian residents, whether citizens or non-citizens. Indonesia has vaccination of government programs and gotong royong vaccination program. Vaccination of government program is the Indonesian government who facilitates this program. The Indonesian government provides this government vaccination program for all the Indonesian citizens. Vaccines are provided free of charge by the government in these programs. If Indonesian citizens are unable to participate in the gotong royong vaccines, it is highly recommended that they participate in the government's vaccination program. The Mutual Cooperation Gotong Royong Vaccination Program was held beginning May 18, 2021 based on a proposal from the business community via the Indonesian Chamber of Commerce and Industry, Kadin, who wants to help with government programs. The Indonesian government encouraged businesses to use their corporation social responsibility funds to cover their employees' vaccinations. The funding for the acquisition of these gotong royong vaccines come from self-funding businesses that want to provide free vaccinations to their employees. The vaccine used in the gotong royong vaccination program cannot be the same as the vaccine used in the government vaccinations program.
So, with the implementation of the National COVID-19 Immunisation Program has shown a good effect by showing a positive recovery in the national economy. Through this immunization program, the economic recovery process will be able to be done smoothly when more economic activity can be open. The country's borders are also reopened. Severely affected sectors such as aviation and tourism will be able to operate again. Similarly, factories that can operate without risk should be closed due to infection among employees. The continuous economic chain will enable the economic cycle to run smoothly. COVID-19 vaccine injection also have been successful in lowering the numbers of daily infection. The number of deaths and patients admitted in the ICU begin to decline.